Penile cancer hides, develops silently in tissue you never see. Daily habits may contribute over decades. Early awareness and change saves lives. 5 daily habits create 5 silent warning signs inside you. Most men ignore these until it's too late for simple treatment. Penile cancer begins when abnormal cells multiply silently deep inside tissue. Poor hygiene triggers this dangerous process through chronic inflammation. Something happens inside penile tissue, while outside looks perfectly normal. Tobacco smoke carries carcinogens that damage DNA without any symptoms. Before your next daily habit, ask yourself one important question honestly. Your honest answer today could genuinely help save your precious life. HPV vaccine prevents infection from high-risk virus types 16 and 18. These 2 types cause most HPV-related penile cancers worldwide. Unprotected exposure allows HPV to reach penile skin. Virus infects basal cells where it can remain dormant for years before causing problems. High-risk HPV integrates its DNA into your cell's genetic code. This permanent change disrupts normal cellular regulation permanently. Viral proteins E6 and E7 destroy your body's tumor suppressors P53 and RB. Without these protectors, cells divide uncontrollably and accumulate damage. Vaccination creates antibodies that block HPV before infection starts. Protected tissue maintains normal cell division, while infected tissue loses control. HPV-infected cells show abnormal growth called dysplasia. Cells lose their specialized function and begin multiplying chaotically in disorganized patterns. Precancerous changes involve full thickness of surface epithelium. This stage, called PEIN, requires medical evaluation and possible treatment. Invasive cancer begins when cells breach the basement membrane. This microscopic event transforms precancer into potentially life-threatening disease. Vaccination triggers your immune system to produce protective antibodies. These circulate constantly, ready to neutralize HPV before infection establishes. Advanced penile cancer destroys normal anatomy and function. Prevention through vaccination offers safer path than treating established disease. Smoking introduces over 70 known carcinogens into your bloodstream. These chemicals reach every organ, including penile tissue, within seconds. Tobacco carcinogens travel through arteries directly to penile tissue. Blood carries these damaging compounds from lungs to genital area continuously. Carcinogens leave blood vessels and enter surrounding penile cells. Once inside, these chemicals begin attacking your cellular DNA immediately. DNA adducts form when tobacco chemicals bind to your genetic code. These abnormal attachments cause replication errors during normal cell division. Cumulative smoking damage builds over time. Each cigarette adds more DNA adducts, increasing mutation risk with every exposure. P53 tumor suppressor gene commonly mutates from tobacco exposure. Without this protective gene, damaged cells survive and multiply dangerously. Genetic instability from smoking causes rapid abnormal cell division. Cells lose normal growth control and accumulate additional harmful mutations. Smoking cessation stops new carcinogen exposure immediately. Your immune system begins attempting to clear existing abnormal cells after quitting. Quitting smoking reduces penile cancer risk over time. Preoperative cessation also decreases surgical complications by 40%. Advanced smoking-related cancer destroys normal penile architecture. Prevention through cessation offers better outcome than treating established disease. Proper genital hygiene requires thorough daily cleaning. Incomplete cleaning leaves behind secretions that accumulate in moist, protected areas. Smegma forms from dead skin cells and natural oils. Trapped beneath foreskin, this material creates environment for bacterial overgrowth. Bacteria in retained smegma produce irritating substances. These chemicals continuously damage the delicate epithelial surface underneath. Phimosis prevents complete foreskin retraction for cleaning. Trapped smegma causes chronic inflammation at the tight constriction point. Chronic inflammation brings immune cells to the area continuously. These cells release chemicals that damage DNA over prolonged exposure. Repeated tissue damage triggers constant cell division. Each division cycle creates opportunity for DNA copying errors to occur. Inflammatory free radicals cause additional DNA mutations. Multiple errors accumulate over years of chronic inflammation. Regular, thorough cleaning removes irritants and bacteria. Inflammation resolves, and damaged tissue has chance to heal properly. Treating phimosis allows complete hygiene and prevents smegma trapping. Medical treatment restores normal drainage and reduces cancer risk. Advanced cancer from chronic poor hygiene destroys normal anatomy completely. Prevention through daily hygiene protects against this outcome. Healthy immune system constantly patrols tissues, eliminating abnormal cells. This surveillance prevents cancer before it can establish. HIV destroys CD4 plus T cells, essential for immune surveillance. Reduced T cell count allows HPV-infected cells to survive and persist. Immunosuppressive medications prevent transplant rejection by blocking immune responses. This same blockade prevents cancer cell elimination. Without functional immune cells, HPV-infected cells avoid destruction. These persistent cells maintain viral oncogene expression continuously. Persistent infected cells begin dividing uncontrollably. Each division creates more abnormal cells with potential for additional mutations. Declining immune function correlates directly with cancer progression. Lower CD4 counts mean higher penile cancer risk. Immunosuppression allows cancer cells to invade through basement membrane. Normal immune response would eliminate these early invaders. Tumors grow rapidly without immune system control. Cancer expands unchecked through normal penile tissue-destroying anatomy. Metastasis occurs when immune system cannot contain primary tumor. Cancer cells travel through lymphatics, establishing secondary deposits. Regular medical monitoring enables early detection in immunocompromised patients. Early intervention succeeds when immune function optimizes. UV phototherapy treats skin conditions using controlled ultraviolet exposure. Genital skin requires special protection during these treatments. UVA penetrates deeply, while UVB affects superficial layers. Both wavelengths damage DNA in exposed skin cells. Inadequate shielding allows UV to reach genital skin. Basal layer stem cells sustain DNA damage during each unprotected exposure. UV creates thymine dimers, where adjacent DNA bases bond abnormally. These distortions prevent accurate DNA replication and repair. Faulty replication past thymine dimers creates permanent mutations. Each UV exposure adds to your cell's mutation burden. Cumulative UV sessions increase total DNA damage. Mutated cells form small clusters that may progress to cancer over time. UV produces characteristic p53 gene mutations. Without p53 function, damaged cells survive instead of self-destructing. Actinic keratosis represents precancerous UV damage on genital skin. These lesions require monitoring and possible treatment. Invasive squamous cell carcinoma develops from accumulated UV mutations. Cancer destroys normal tissue architecture as it grows. Proper genital shielding during phototherapy prevents UV damage completely. Protection allows treatment benefits without cancer risk.